am Dr. Robert Dupont, and I am thrilled to be with you in Houston at this convention. I am a very big fan of drug courts. I started my career in addiction medicine 50 years ago. July 1st marks the time, and I came to work in the Department of Corrections because I cared about people who were in prison and wanted to help them with my medical training, and that got me into drug treatment. And I can tell you, of this 50 years, one of the best ideas that has happened in that period of time is the drug court movement, because what it does is it links the criminal justice system to treatment to promote recovery for the people who you and I care about, who are the people who are caught up in the criminal justice system. It uses the criminal justice system to save lives and to promote recovery, and that is something we can share. That motivation, that goal, it's really very important. Now, another phenomenal idea in this field is the Oxford House, which is a unique program to extend recovery beyond treatment and during treatment by having a home for people to live in that is sober and is other people who are working together for recovery. And it is paid for by the people who are in the house. It is a remarkable example of recovery enterprise, extending the benefits of treatment and finding a home for people to be in. And Oxford houses reinforce what's going on with the drug courts and your goals and make it work better. So I want you all to, I encourage you to learn about Oxford House and see what's going on. It's the miracle of recovery under a roof that people share together, and it is a phenomenal development in our field. To me, the great change that has gone on in the addiction field over this time is the emergence of the recovery movement. We now have 22 million Americans who are in recovery, and that concept of recovery is extremely important in defining what we're after, what we want to get. Our effort is not to reduce the amount of drugs people are using or find ways to reduce or mitigate some of the harms associated with drug use. Our goal is to get people clean and sober and get them into recovery that is stable. I've worked personally, I'm very proud of a study of physicians and how physicians are treated for addiction. And they are treated with an intensive program that has zero tolerance for drug use. And one of the things that program does is make relapse the exception rather than the expectation. Too much in our field, we define relapse as an inevitable part of addiction. It isn't. And for many people, recovery is not only possible, but it's stable. And we want to make sure that that goal is clear of what we're doing. And I think that that's really very important. Oxford houses can help promote the goal of recovery and can get more people into recovery. And the leverage of the criminal justice system through the drug courts is extremely important in getting this to happen. And I think that that's very important to think about linking treatment with the criminal justice system, and think about the role of Oxford houses as a place where people can go and work their programs of recovery and achieve sobriety. 80% of the people who leave Oxford houses leave clean and sober, not relapsing. They make the outcome, the expected outcome, recovery and not relapse. So I welcome you to Houston and to this meeting, and I want you to know that I believe you are working in one of the most important areas of our nation's dealing with the drug epidemic, and that is the positive use of the criminal justice system to identify the brain disease of addiction and to make recovery the expected outcome, not relapse. Again, this is Dr. Robert Dupont. I have been in the field a long time. I'm a medical doctor, and I believe in what you're doing, and I think it's a tremendous contribution to our country, and it is saving lives and communities, and I salute you for it, and I commend to you the Oxford House movement, which I think is a dramatic example of recovery in action. Thank you very much.